Hello and welcome to Ground Rounds in Emergency Medicine. My name is Giuliano di Portu. I'm an assistant professor of emergency medicine at the University of Florida. And today we're going to be talking about aerospace medicine. I have nothing to disclose. And I'm actually recording this on a special date. We're remembering our fallen astronauts. It was a day 50 years ago when we lost the crew of Apollo 1 during a fire in the cabin. We were also going to remember the crew of Challenger. January 28th, 1986. They died when there was a catastrophic malfunction of one of the O-rings on one of the solid rocket boosters. And we're also going to remember the crew of Columbia. They died on re-entry on February 1st, 2003. So they gave their lives in the quest and the exploration of space, so we're going to remember them. The objectives of the talk are to discuss a little bit of the history of space travel, talk about the medical support that University of Florida gave to NASA during the shuttle years, some changes that occurred during space flight, and a little bit of ultrasound in space medicine. And I want to start with a little bit of history and Greek mythology. This is a painting that sits in the El Prado Museum in Spain. And it's the story of Icarus and his father Daedalus. They were trying to escape from the island of Crete. They were imprisoned by King Minos. His father, in order to escape, made wings out of wax and feathers. And he told Icarus, "You can't fly too close to the sun because your wings will melt." But he didn't listen to his father and his arrogance, and made him fly close to the sun, and he fell to his death. So kind of one of the first casualties in aerospace medicine. Leonardo da Vinci from Italy had many drawings. He was so ahead of his time, and he made this drawing in the 15th century. And the majority of his drawings were actually not discovered till the 19th century, so they laid untouched, and he was such a visionary man. We talk about folks that in the arts and writers, like Jules Verne. He wrote From Earth to the Moon. They also made a movie in France about it, and it just shows that quest and that inquisitive minds trying to look to the stars for inspiration. And the modern history of space travel, we have to credit Dr. Wernher von Braun from Germany. He used to work along the Nazis, and his project was the V2 rocket that was unfortunately used during the war against England. But the truth is that his design was very important in the early days of rockets. And after the war was over, some of the German scientists were recruited by the United States. And Dr. von Braun was one of the ones that came to the United States. And we see him here next to the engines of the Saturn V rocket. He was one of the founders of NASA. On the Russian side of things, we have Sergei Pavlovich Korolev, one of probably the founding father of the space program in the former Soviet Union there with Yuri Gagarin. We'll talk a little bit more about him. But if we go about our history, the Soviet Union put this little fellow a day in October 1957, and it was Earth's first satellite. Those are the radio signals that Sputnik was broadcasting to the world as it circled the Earth for 3 months. And obviously that was quite an accomplishment by humanity. We had just placed a satellite into space Of course, the Russians were beating the Americans in the space race, as you can imagine. Um, the United States were thinking that this is definitely a Russian victory, and the problem is that both sides were commissioned basically or pushed by the military to create bigger and faster rockets, and the concern is that if you were able to move a satellite, you were probably able to move a nuclear weapon, and that was the concern. So, but they were advancing in the progress made in the quest for space. Then the Russians continued, and they moved the first animal in space, Laika. She was a stray dog found in the streets of Moscow, and she was the first one. Unfortunately, Laika died probably about 5 hours into the flight of heat exhaustion. Probably poor Laika had a massive heart attack. Who knows? But she was the first one up there. The United States put some other folks up there. I think that's Ham, and then definitely some other primates taking a trip to outer space. But the truth is that the first man in space was Yuri Alexeyevich Gagarin. April 12th, 1961, 9:07 Moscow time. He made history as the first man in space. And apparently Yuri didn't actually return on the same spaceship. He had a malfunction and he parachuted down, but no one knew until about 1971 when it was made public. But he's still credited because he was the first man up there. So a couple of weeks later, Alan B. Shepard became the first American in space. And again, we were a little bit behind in the quest for the stars, but the first 7 astronauts seen here were the first pioneers. Some of them were naval aviators, and they were ready to go. So the first American in orbit, John Glenn, in 1962, aboard the Friendship 7. He named it because of the 7 astronauts. He was the first American in orbit, and he was also the oldest man in space. He was 77 years old. And as you can see, as time went by, we had from the Mercury program smaller ships. Mercury, then Gemini, then the Saturn V, the rocket that went to the moon. You see the size of these rockets compared to the shuttle, for example. But that's pretty interesting. Then we have Dr. Eugene Buzz Aldrin during one of the Gemini flights in 1966. He was taking some images, infrared images. So he was only shooting pictures when he was not in sunlight. So while he was in the sunlight, he wasn't able to shoot pictures. So he said, "Well, I'm just gonna." I was kind of flying around, and he said well, let me just. He turned the camera to himself, and I guess he made the first selfie. Actually, is hashtag space selfie and the first selfie, and then all the other astronauts are kind of following the tradition of the selfies, and even the Mars rover is doing selfies. Kind of crazy there. So let's do a little bit of space trivia here. Who did the first spacewalk, or the first extravehicular activity, or EVA? You think 1965. Cosmonaut Alexei Leonov, and he did a 12-minute, 9-second spacewalk. So he was the first one to do it. How about let's do the first woman in space? 1963. Okay, you can take a guess. Also from the former Soviet Union, Valentina Tereshkova. There you go. Okay, let's give you an easy one about the first man on the moon. So we beat the Russians and everybody there as July 20th, 1969. Neil Armstrong with his famous message to the world: one small step for man, one giant leap for mankind. So, okay, so that's the first man on the moon. What about the second man on the moon? Well, it's got to be the astronaut sitting right next to him, and that was Dr. Eugene Buzz Aldrin. Pretty famous picture. So, how about the last man on the moon in 1972? Apollo 17, and that was Gene Cernan. Actually, he passed away a couple of weeks ago. About the first American woman in space. She was also the youngest astronaut, and it's Sally Ride, June 18th, 1983, during one of the Challenger flights. And if you take a look at these rockets, they're just beautiful and really, really big, and they transfer them in these giant crawlers there, and it's a journey that takes many, many hours, and they're traveling on those big lanes at maximum speed of 2 miles an hour, and those lanes are filled with Tennessee River rock, about 8 feet of rock and gravel. And you know why they use that special rock from Tennessee? Well, it's because it's the only rock apparently that can crack and won't create a spark. And the least thing you want to have are rocks creating sparks when you're moving rockets full of like liquid hydrogen and liquid oxygen. So, folks at NASA are pretty smart guys. So when we talk about like shuttle launches, and they went through this program of liftoff, SRB separation, then you had the external tank separation, you were into orbit, you did your thing, some orbit operations, you deorbit, re-entry, and you land. Pretty simple, huh? So let's talk a little bit about what goes on when the shuttle launches. So probably about a minute or so before the engines start, the water suppression system there at the launch pad is activated. The main use of that suppression system is to dissipate acoustic energy. That will be really, really impressive and could affect the vehicle. So here you can see it. You have about 300,000 gallons of water coming down through 7 feet diameter pipes that are feeding these things they call rainbirds. You can see them there just pumping water. And you can see a high-speed camera showing all these flashes of light that are occurring here. They're just waves of acoustic energy that's being dissipated on all the water. It's being evaporated, so the majority of the white clouds that you're seeing, that's just basically water vapor. You have to think about it. You're burning about 1,000 gallons of liquid propellant per second, about 20,000 pounds of solid rocket fuel. You're talking about 7.5 million pounds of thrust, okay? And basically the liquid portion is a liquid hydrogen, that's a fuel, and then liquid oxygen as the oxidizer. More trivia is that one of those main engines, one engine can propel 2 747s, okay? And the solid rocket boosters are basically ammonium perchlorate as the oxidizer, and the aluminum is a fluid. So I'm going to show a video of a launch. There's some things that occur that are important, and with every rocket that is launched, there's a point, and it's called maximum Q. And this is a graph that's showing you on the left side here. That's time 0, obviously. You're sitting on the launch pad, and you're going to have a graph of altitude. You're going to have a graph of velocity there in red. And as you gain, obviously, velocity and altitude, you create pressure on the vehicle, okay? And that is because you have density of the atmosphere kind of compressing against the vehicle. The higher you go, the less denser the air becomes, and there's a point that maximum dynamic pressure on the vehicle reaches a maximum, and then as the atmosphere decreases, then the pressure also decreases. So you reach that maximum Q. Sometimes you hear the announcer say maximum Q. Basically what they do is they throttle down until they pass that point of maximum dynamic pressure, and then they are able to throttle up. And you hear the announcers sometime will say you're in the bucket. And in the bucket means that if you plot a graph of thrust in time, once you're moving along, there's that point when you throttle back. If you look at the graph, it looks like there's a space that looks like a bucket, so they call it that. So I'm going to show a video now of a launch. Pay attention. You're going to see that when the main engines start, the vehicle actually rocks about 4 degrees forward just because of the immense torque that's occurring, and the astronauts call that the twang. So the main engines start at around T-5 seconds, and it takes the vehicle 4 seconds to come back to the original position, and that's when time they come back. Then the bolts that are holding the solid rocket boosters actually are explosive bolts, and they blow, and then you have liftoff. And once you light those solid rocket boosters, you can't turn them off. So here you go. I'm going to sit back and enjoy the launch.
Go for main engine start.
And here they go.
Liftoff confirmed. Copy liftoff. Houston Discovery, roll program.
Roger, roll Discovery.
Okay, see the roll. Good roll maneuver.
Copy, good roll.
Throttle down, turn 72.
Copy, in the bucket.
Here's the point now when they're reaching maximum Q, and as soon as they pass that, they're going to get the signal to throttle back up.
Throttle up, turn 104.
Go at throttle up. Discovery Houston, you are go at throttle up.
Roger, go at throttle up. On PDL.
Copy on PDL. Booster, how do the engines look?
Flight booster, all three look really good.
Copy that.
So you're about to see the moment when they told Challenger to go with throttle up as they would normally do, and this is unfortunately when the accident occurred. And again, I'm just going to play it so you can see what happened.
Challenger, go at throttle up. Roger, go at throttle up.
This shuttle mission will launch, my God.
1 minute 15.
There's been an explosion.
So this is a high-speed camera during the launch when you see the black cloud coming out of the O-ring, and again you see that plume of fire coming out of the O-ring that eventually burned and caused the accident. These pictures are like about 100 milliseconds apart, and you just see the orange cloud. That's the nitrogen tetroxide and the hydrazine that burns red.
The initial emergence of the crew cabin from this perspective was at 75.237 seconds. The left wing became visible at 78.531 seconds. The main engines and crew cabin are also identifiable. After 10 seconds, the crew cabin was seen again with the front end and top of the cabin visible.
So this is from the Challenger accident report. Quoting from the report, the range of maximum accelerations was 12 to 20 Gs in the vertical axis. They were quite brief, and they were below 4 Gs, and in less than 10 seconds, basically, they were in free fall. Medical analysis indicated that those accelerations are survivable, and the probability of major injury was low. But at the height of where it occurred at 48,000 feet, where the loss of pressure Without the oxygen, most likely you probably had a loss of consciousness. That was kind of the hypotheses. The problem is that some of the personal egress air packs that contain emergency air, not oxygen, 4 of those were for recovered, and 3 had been activated. And you can see the egress packs here. This is a stock photo. This is not Challenger, but from NASA, I got that picture. They're saying that that activation could have been an instinctive response to the cabin loss of pressure. The truth is, even with that, at that altitude, probably it would not have prevented rapid loss of consciousness. They said that the cause of the death of the astronauts could not be positively determined, and that the forces to which the crew were exposed during breakup were not sufficient to cause death or serious injury. You have to think that the shuttle is designed to withstand certain G's, but when you change the axis at that velocity, it just destroyed the vehicle. They were never able to confirm that there was an explosion. There was never a sonic boom confirming an explosion. The fuels got consumed and the vehicle was destroyed. And from the report, they're saying that the crew possibly, but not certainly, lost consciousness in the seconds following orbit breakup due to in-flight loss of crew pressure, module pressure. The truth is, unfortunately, they hit the ocean about 207 miles an hour, and that is obviously non-survivable. This is the crew of Challenger, and it was even special because Krista McAuliffe was there. She was she was going to be the first teacher in space, and all the schools in the United States were watching this live. I remember I was watching it live, and it was obviously quite tragic. Richard Feynman, a Nobel Prize in Physics, was part of the investigation. He said, for a successful technology, reality must take precedence over public relations, for nature cannot be fooled. He took a piece of the O-ring and put it in a bucket of water and showed one of the commissions how the O-rings would like crack and change their conformation, showing that the O-rings were the culprit of this catastrophe. So after Challenger, obviously the flights were grounded, and they continued to determine what are good measures to try to like prevent loss of life. And they have several things. You have the launch, and then you can do a return to launch site, RTLS, or if you are too far from the Cape, you sometimes hear the announcer, they will say no return. That means that you're too far to return to the launch site. So you have transoceanic aboard landing sites. You have several of those, and if you've never been to Barcelona, Spain, you're going to be there in about 30 minutes. You're going to cross the Atlantic, and you can do that, or you can do what's called a aboard once around, and you just go once around and then come back, or you obviously can go and be in orbit. So what NASA and UF had kind of partnered, there's that Dr. Dave Muir, one of the physicians that would go to the launches and landings. They were part of the support team to NASA. And if you're sitting there in the launch pad, you have several options. If let's say there's a leak of fuel, the astronauts are able to come out of the shuttle and come down, and there's some slide wires, and they take these like little baskets, and they get in the baskets, and they get the heck out of there. They go all the way down. When they have support crews waiting for them, they can get into this like tank. And you can see the launch pad over here. They take this tank and they come to where the medical support teams are waiting, and you can see them. This is a drill where they're practicing, decontamination of some of the astronauts. And you know, some of the things that are up there, other than the obviously the liquid nitrogen, liquid hydrogen, I'm sorry, liquid oxygen, are what they're called hypergolic fuels, and such as hydrazine and then nitrogen tetroxide. And those hypergolic fuels are pretty stable when they're on their own, but when you combine them, they spontaneously ignite, and the propellants usually consist of a fuel and an oxidizer. And those hypergolic fuels are interesting because they do not need an ignition system, and they can fire any number of times by simply, you know, opening and closing valves and combining those propellants. So they're definitely uniquely suited for space travel. These are some of the heat hazards that can occur if you're returning and landing. So those are the parts that have heat hazards. You have explosive hazards because of the side hatch, top hatch, the chute door in the back, and then, you know, chemical hazards. We talked about ammonia, the hydrazine, and the nitrous tetroxide. So you can do abort procedures. We talked about return to launch site. The truth is that can only be done after a solid rocket booster separation, and it's a procedure that when you're normally, once you do the roll maneuver, you're basically belly up and you're looking down at the curvature of the Earth. So if you want to return, you have to like rotate again and try to align the shuttle with a cape. So you're about to see the moment when they told Challenger to go with throttle up as they would normally do, and this is unfortunately when the accident occurred. And again, I'm just going to play it so you can see what happened.
Challenger, go and throttle up. Roger, go and throttle up.
This shuttle mission will launch, my God.
1 minute 15.
There's been an explosion.
So this is a high-speed camera during the launch when you see the black cloud coming out of the O-ring, and again you see that plume of fire coming out of the O-ring that eventually burned and caused the accident. These pictures are like about 100 milliseconds apart, and you just see the orange cloud, that's the nitrogen tetroxide, and the hydrazine that burns red.
The initial emergence of the crew cabin from this perspective was at 75.237 seconds. The left wing became visible at 78.531 seconds. The main engines and crew cabin are also identifiable. After 10 seconds, the crew cabin was seen again with the front end and top of the cabin visible.
So this is from the Challenger accident report. You know, quoting from the report, the range of maximum accelerations was 12 to 20 Gs in the vertical axis. They were quite brief, and they were below 4 Gs, and in less than 10 seconds, basically, they were in free fall. Medical analysis indicated that those accelerations are survivable, and the probability of major injury was low. But at the height of where it occurred at 48,000 feet, with the loss of pressure, without the oxygen, most likely you probably had a loss of consciousness. That was kind of the hypotheses. The problem is that some of the personal egress air packs that contain emergency air, not oxygen, 4 of those were for recovered, and 3 had been activated. And you can see the egress packs here. This is a stock photo. This is not Challenger, but from NASA, I got that picture. They're saying that that activation could have been an instinctive response to the cabin loss of pressure. The truth is, even with that, at that altitude, probably it would not have prevented rapid loss of consciousness. They said that the cause of the death of the astronauts could not be positively determined, and that the forces to which the crew were exposed during breakup were not sufficient to cause death or serious injury. You have to think that the shuttle is designed to withstand certain Gs, when you change the axis at that velocity, it just destroyed the vehicle. They were never able to confirm that there was an explosion. There was never a sonic boom confirming an explosion. The fuels got consumed and the vehicle was destroyed. And from the report, they're saying that the crew possibly, but not certainly, lost consciousness in the seconds following orbit breakup due to in-flight loss of crew pressure, module pressure. The truth is, unfortunately, they hit the ocean about 207 miles an hour, and that is obviously non-survivable. This is the crew of Challenger, and it was even special because Krista McAuliffe was there. She was she was going to be the first teacher in space, and all the schools in the United States were watching this live. I remember I was watching it live, and it was obviously quite tragic. Richard Feynman, a Nobel Prize in Physics, was part of the investigation. He said, for a successful technology, reality mistake precedence over public relations, for nature cannot be fooled. He took a piece of the O-ring and put it in a bucket of water and showed one of the commissions how the O-rings would like crack and change their conformation, showing that the O-rings were the culprit of this catastrophe. So after Challenger, obviously the flights were grounded, and they continue to determine what are good measures to try to like prevent loss of life. And they have several things. You have the launch, and then you can do a return to launch site, RTLS, or if you are too far from the Cape, you sometimes hear the announcer, they will say no return. That means that you're too far to return to the launch site. So you have transoceanic aboard landing sites. You have several of those. And, if you've never been to Barcelona, Spain, you're going to be there in about 30 minutes. You're going to cross the Atlantic, and you can do that, or you can do what's called a aboard once around. And you just go once around and then come back. Or you obviously can go and be in orbit. So what NASA and UF had kind of partnered, there's that Dr. Dave Muir, one of the physicians that would go to the launches and landings. They were part of the support team to NASA. And if you're sitting there in the launch pad, you have several options. If let's say there's a leak of fuel, the astronauts are able to come out of the shuttle and come down, and there's some slide wires, and they take these like little baskets, and they get in the baskets, and they get the heck out of there. They go all the way down. When they have support crews waiting for them, they can get into this like tank, and you can see the launch pad over here. They take this tank and they come to where the medical support teams are waiting, and you can see them. This is a drill where they're practicing decontamination of some of the astronauts. And some of the things that are up there, other than obviously the liquid oxygen, are what they're called hypergolic fuels, and such as hydrazine and then nitrogen tetroxide. And those hypergolic fuels are pretty stable when they're on their own, but when you combine them, they spontaneously ignite, and the propellants usually consist of a fuel and an oxidizer. And those hypergolic fuels are interesting because they do not need an ignition system, and they can fire any number of times by simply opening and closing valves and combining those propellants. So they're definitely uniquely suited for space travel. These are some of the heat hazards that can occur if you're returning and landing. So those are the parts that have heat hazards. You have explosive hazards because of the side hatch, top hatch, the chute door in the back, and then chemical hazards. We talked about ammonia, the hydrazine and the nitrous tetroxide. So you can do abort procedures. We talked about return to launch site. The truth is that can only be done after a solid rocket booster separation, and it's a procedure that when you're normally, once you do the roll maneuver, you're basically belly up and you're looking down at the curvature of the Earth. So if you want to return, you have to like rotate again and try to align the shuttle with a cape. So you're going to watch a video now when they are doing this hypothetical maneuver. This is a simulation. It was never done. Remember, once you dump that external tank, you're cutting the fuel to the main engines. Without that external tank, you're basically having a big, heavy glider, and then some of the pilots say that it's like trying to fly a brick. So you'll see the simulation, computer simulation of the shuttle now trying to align with the cape and dumping the external tank.
Flight is pitching up too high. Let's get those down. Check. Okay. 602. He's pitching down.
So let's talk a little bit now about the physiological changes of space travel. That's a picture of the Skylab. That was in the 70s, the first time that we had a big lab and kind of a space station up there. Some of the astronauts there having kind of lots of fun. And then we talk about changes in physiology. We have to talk about principles like Boyle's law that says that a fixed amount of gas at a fixed temperature, the pressure and the volume are inversely proportional. So for example, a liter of gas at sea level, it becomes 1.5 liters at 9,000 feet. You can do the math there in the privacy of your own home. The body's also exposed to G forces, gravitational forces, and you see here that the different flights had different G forces on the way up and then on the way down. Mercury 8 G's going up and 6 coming down. Apollo a little bit less, 6 going up, 7 coming down, and the shuttle 3.4 going up. That's subtle if you compare it to the other ones, but you definitely have G forces that are acting on the body, and pilots train for these forces. You're going to see a video because it's from the Air Force Academy where they train their pilots. They're supposed to learn how to breathe and keep the blood from basically coming out of your head into your legs, and if it does that, then you'll pass out. Your brain kind of likes that blood flow, so you have what's called a G lock, G gravitational loss of consciousness. And here's the video.
Stay tight, stay tight, stay tight, stay tight. Hello? Are you with me?
You have some myoclonic jerk there.
Around? Hello? How you doing?
What?
Hello, Will?
Hello.
Will, sit up.
I'm up.
Sit up.
I'm up.
You're up? Put your head up.
It is up.
Put your head up.
Oh.
Twinkle, twinkle, little star.
These guys are out.
I wonder what you are.
I did spend a lot of time watching funny videos on YouTube there. So based on the principle of like blood coming out of your head into your legs, they invented in the 80s these medical anti-shock trousers called masked trousers. And they initially sounded like a great idea because you just inflate, you can inflate the legs and to try to keep flow out of the legs into the torso, the head. Then you have an abdominal component that you can inflate. That sounds great in hypovolemia. They published some early literature in trauma about the use of the masked trouser pants. But then they had some issues like, lower extremity ischemia associated with that. So they're not really used in modern times. So other emergencies that you can have once you're up there, you've made it there. You're in orbit. You're going to do a spacewalk. You can go repair Hubble. So what are the concerns? Well, you can have a decompression, DCS, decompression stress, and it's different from the one that divers experience, the altitude DCS versus the diving. So for comparison, nitrogen, which is the main culprit of like bubble formation, decompression starts from ground level in the nitrogen saturated state. Usually in diving, you don't really worry about these things. At altitude, you're breathing high oxygen. You don't breathe oxygen when you're diving. For example, you do denitrogenation as a measure to prevent DCS. The concept in diving, again, that doesn't exist. What happens is basically that the partial pressure of nitrogen decreases with altitude, but when you're diving, the partial pressure of nitrogen actually increases. So you have a lot of nitrogen there in tissues. What happens is that during the ascent, the partial pressure in tissues of nitrogen is greater than atmospheric pressure. If you have a sudden decompression, the normal balance is that the nitrogen that it's in the tissues is going to balance, is going to come out of tissues, going to go into the bloodstream, and you're going to exhale. But if that decompression exceeds the critical rate for the given tissue, it's not going to unload that gas, and the tissue is going to become supersaturated. That's the concept. And bubble formation basically is directly proportional to that level of supersaturation. So what do they do before they do an EVA? So they pre-treat the astronauts before that spacewalk with about 4 hours of 100% oxygen. Actually, if you get on a treadmill and breathe the oxygen, it doesn't really take the 4 hours. So that kind of performs like a nitrogen washout, and you're decreasing the risk of DCS. And you do that in anesthesia. You kind of pre-oxygenate with oxygen. So let's continue to talk about changes in physiology. Short term, you're sitting there on your rocket about to launch, and you have some hormonal changes. If you're thinking about it, you're sitting with your legs up. What's going to happen to the blood supply? So it's kind of the reverse of what we're talking about with a G-lock. Instead of going from your head to your feet, it's going to come from your feet to the torso and to the head. And you're going to start stretching the baroreceptors in the aortic arch and then in the carotid sinus. And that's going to trigger signaling to your body to decrease blood pressure. If you think about it, just by entering microgravity, there's an immediate shift of dependent fluids into the cephalad position, and that results in diuresis and a decrease in systemic plasma volume, 10 to 20%. It's another picture from NASA. But basically, you're stretching those receptors to stretch the heart, and you have, the atrial natriuretic peptide influencing, decreasing the renin and angiotensin system. So you're just promoting natural diuresis and increase excretion of water, hence decreasing blood pressure. And I'm going to show you a video from the movie The Right Stuff. And this is a true story. Alan B. Shepard was sitting there about to launch, and it was a 15-minute flight. He was supposed to be there for 2 hours. He got delayed. I think he spent like 5-6 hours, and he needed to go. And he said, like, well, I need to go. And they finally said, well, just go ahead and do it in your suit.
Jose, permission granted to wet your diapers anytime, son.
Suit thermometer says freon flow, jumping from 30 to 45.
So there you go, Alan B. Shepard. That was a true story. So what else could go wrong? Well, your neurovestibular system gets a little bit out of whack. You have just a refresher. You have the vestibular system, and you have the semicircular canals. They have to do with angular acceleration, and then you have the otolith system with the sacral and the utricle. Those deal with linear acceleration, but you're basically flipping around in 360 degrees and several planes X, Y, and Z. So you're over stimulating all these receptors, and they've looked at it. Obviously, you have space motion sickness, and it occurs in 60 to 80% of astronauts, more frequently with larger vehicles such as the shuttle than Mercury and Apollo, when you're basically strapped to the chair and there's not a lot of things that you can do to move around. So neurovestibular, you have vomiting, obviously anorexia, headache, stomach awareness. I'm not really sure what that means, but they did see that there was no gender differences had been found, and nor history of previous flight experience had benefit in any way. So they did see that normal space sickness just basically disappears by day number 3. So basically they do limit the cruise in the heavy stuff the first couple of days. So basically no EVA for you for the first 3 days. They're not gonna let you do that. And that's the formula for orbital velocity, if you're wondering there. So what other changes occur in physiology? Intermediate. So you can have cardiovascular arrhythmias, PVCs, premature ventricular contractions are common. In orthopedics, you can have what's space osteopenia if you're not careful. You can lose about 1 to 2% of bone loss per month. That is, if you compare to being on Earth, you start losing 1 to 2% per year, not per month. So you can have trauma because you're just floating around. So there's increased risk of blunt injuries, burns, infectious disease. You're just floating around there with your comrades from the Soviet Union, and the weightlessness basically helps with the aerosolization of bacteria and viruses, and they're just sticking around. You can cross infect with other folks there. So neurologic, we talked about motion sickness, headaches, visual disturbances. We're going to talk about that a little bit further on. And urologic, those are frequent problems. If you're thinking about it, you have decreased intake, you have increased excretion of water, and then you have increased calcium excretion because your bones are probably demineralizing a little bit, and that goes into the blood, and you start just dropping renal stones. And there's many events of renal stones. Actually, apparently one of the few times, or maybe the only time, that they had to deorbit an astronaut, it was from the Soviet Union. They thought he had appendicitis, so they brought him down. He ended up having a renal stone. Well, if you think about it, bringing somebody down, it's about a $400 million ambulance ride. So you wanna make sure everybody's okay. Psychiatric, not well studied, but there's obviously isolation, anger. They have done studies. They compare to the folks in Antarctica, all those really isolated places. So those are kind of intermediate things. If you think about long-term changes, obviously those are not well studied. But mission to Mars could be anywhere from 6 to 8 months, and that's depending on the orbits of the planets. And you also have a 23-minute delay in communications. So when you talk about having somebody with a medical emergency, for example, you can do telemedicine, but I'm sitting there, I'm trying to talk to the folks on the spaceship, and I can't just go say like, hey, don't do that, because it's going to take 23 minutes to get to them, right? And you're thinking, well, what about, hold on, radio waves don't transmit in a vacuum. But radio waves are actually not sound waves. The sound in an astronaut's helmet gets converted into radio waves, and those are electromagnetic waves. So they move probably at the speed of light. So you have that delay. So, but for the long-term effects, they've done some studies. Scott Kelly and his twin brother, they just did about a year ago. They spent a year in space. He spent a year in space, and his twin was back on Earth, Mark and Scott Kelly. And there's a lot of data and a lot of folks working on publications about long terms. And you talk about cardiovascular reconditioning. You have immune suppressions. They've shown that there's a decreased cytokine production. Again, psychiatric issues, osteopenia. They do strenuous workouts there, 3 to 4 hours a day, just to maintain that bones in a great condition. You have some visual impairment. I'm going to talk about that, and obviously you have radiation exposure. When you're close to the Earth, you're still protected, but once you get out of that protection of Mother Earth, you are exposed to all the space radiation. Interesting, for example, you have some folks from the University of Kentucky doing studies on how to create a system that you could suture. If you have a laceration there, the blood's just going to fly around, so that you can see that they have like this hood, and they're trying to do like surgical repairs, kind of like laparoscopically. There you have some sutures there. So interesting, lots of research going on. So you're in the space station, and you want to have some sort of medical imaging modality right up there. So do you think they're going to take a CT or an MRI up there? No, it's too heavy. Actually, I think the cost of having something flown up there, or actually the cost per pound, is about $10,000 per pound. So if you start to do the math, that's obviously not going to fly, no pun intended. So the folks at the International Space Station have the Advanced Diagnostics Ultrasound and Microgravity kind of program. So all the astronauts are like ultrasound gurus. I would love to say that, because I'm kind of an ultrasound guy myself. But they do. You see the ultrasound machine there, and they do lots of ultrasound on each other. Here's a picture of Drs. Kodakowski and Dr. Sargasan doing telemedicine with some of the astronauts. They're doing an ocular ultrasound. And there's some publications about ultrasound at the space station. Obviously, there's not a lot of folks that have been up there. So some papers that I came across: evaluation of shoulder integrity in space. Again, here's one of the astronauts scanning the other. He's there at the shoulder joint in a transverse plane, looking at the humerus. Basically, they're looking at the tendon of the biceps, probably right about there, in between the greater and the lesser tuberosities, and then you have the deltoid a little bit more anterior. So that they were evaluating if astronauts with only 2 hours of training could obtain adequate images, and they were getting those images in about 10-15 minutes with no difference when they compared to ultrasonographers that were involved in the study, that they did the studies on Earth. There's another publication from the Journal of Trauma. It's called Fast at Mach 20. So they had some astronauts with 3 hours of training at Johnson Space Center. Flight surgeon with ultrasound experience guided the astronauts in real time. There's this 2-second delay, not so bad. And then they were evaluating the images at Johnson Space Center. So these are the images from the FAST exam. You can see pretty good images. They also have some guidance with some charts that they can also help in the acquisition of the images. The idea is to train them because if you do have a loss of communication, they have to do their thing, right? So there are, when I was talking about visual changes, there's well documented changes in near vision from the astronauts. This is a case report. These are some of the astronauts just wearing corrective lenses. But this was a 57-year-old male astronaut that had normal fundoscopy prior to the first visit to the International Space Station, and 6 weeks into the 6-month flight, he reported near-field changes. So fundoscopy after the mission showed that he had changes in one eye, and there's a little bit of a refresher there of the anatomy of the eye, and he had some changes in the choroid segment. He had they were called choroidal folds, and those are, you can see them, they're parallel grooves that affect the choroid in the posterior pole. They're caused by stretching and thinning of the retinal pigment, and they occur because of compression and high pressure. He also had a convulsed spot, and those are also seen in patients on Earth that have high blood pressure, and they're like fluffy white patches there on the retina. So interesting. So he came down, and then he went for another mission, and he had a preocular evaluation that still showed choroidal folds, not as prominent. They were seen by like more complex exam. But 5 months into the flight, he again developed changes, and you can see they did a fundoscopy, and you definitely see that there's disc edema, and if you do an ultrasound, they did an ultrasound of the optic nerve sheath diameter, and it was 0.73 centimeters. Shouldn't be more than 5. When you do measurements of the optic nerve, you go 3 millimeters down, and it shouldn't be more than 5 millimeters. Anything greater than 5, it's definitely increase in ICP, intracranial pressure. Since 2009, they are scanning all the astronauts for those changes. And there's another paper of optic disc edema, globe flattening, choroidal folds. They did a retrospective observational study on 7 astronauts, and they did a post-flight questionnaire on about 300. 7, like those 7 underwent complete eye exams. I'm sorry, and they were evaluating for refractive changes. After 6 months, they all had disc edema, 5 had globe flattening, and 5 had choroidal folds. Again, all signs of increased pressure. And this is an MRI post-return when you actually see the globe flattening here, and then you have the swelling of the optic nerve. And the hypothesis is that these ocular changes occur due to cephalite fluid shifts in microgravity. So what is NASA doing? They're doing a lot of research on the fluid shifts before, during, and after prolonged space flight. And how does that affect intracranial pressure and visual impairment? So you have one of the astronauts there on the Russian side. He's sitting there on those pants. Those pants are meant to be negative pressure. So the idea is that instead of the fluid going cephalad, that those pants are like kind of like sucking the blood back into the legs, and all that fluid into the legs. So the hypothesis was there. So what they did some ultrasound, and they were measuring jugular, portal, femoral, and cap vein cross-sectional areas to try to see if there was actually redistribution with long space flight. So that's one of the twins there. He's scanning his jugular, probably part of the experiment. So the idea was to determine if 6 months in space resulted in changes in the major central and peripheral veins, indicating a redistribution of venous blood flow. So they had 10 astronauts, 7 male, 3 female, 45 plus minus 5 years. They were doing vessel cross-sectional area pre-flight, day 15, and near the end of the mission. And they did jugular, portal vein, femoral vein, gastrocnemius, and they do the long axis and short axis, and the computer would calculate volumes. It's kind of a French study, and they did see if you compare the volumes of jugular vein, for example, pre-flight, and then the volume 15 days, 4.5 months, and then when they return, obviously showing that there's an increase in the cephalad migration of fluids. They all increase volume in the jugular and the portal, femoral, and reduce in the calf, meaning that blood was out of your legs going upwards. So what is the next thing going on here? Well, Orion will launch, will continue the mission to bring humans in the exploration of space. So that's pretty exciting. You have Dr. Buzz Aldrin there with his campaign, Get Your Ass to Mars. and that's great. So this is one of the advertising that we had here at Shands with how we looked out for the astronauts. It's pretty cool. So I want to at the end of the lecture, I want to give a shout out here, Dr. Myers, Dr. Muir, Dr. Smith, one of our trauma surgeons, and one of our medical students, Major Matthew Booth. There, he's a second year former F-22 pilot. They all helped me out, get some information for this lecture. So shout out to them. This is a picture that my son Giuliano drew actually 2 days ago. He called it Spaceman, Ship, and Invisible Martian. So pretty awesome there. You know, and this is we're here in California checking out the Endeavor. All right, so thank you for watching. If you have any questions, feel free to drop me an email, and thank you for listening.